So it's tummy tuck. Hi, it's Dr. Mabourakh, Folsom Plastic Surgery. Today I wanted to go over how you can recover after abdominoplasty. This is a tummy tuck where we've also performed liposuction. As you remember, there's no drains involved. We did a no drain tummy tuck. So as you leave here, you're going to have a special dressing on and a garment that we apply. Now, when you go home, the biggest thing is I do want my patients out of bed, walking around the house the same day. What do I mean by that? Every hour or two, get up, go to the bathroom, go to the kitchen. I don't want you to stay in bed all day. I don't want you to do anything either. Just get up, walk and rest so we get those bloods moving in the legs so we don't get blood clots. The next important thing is things are very tight. When we do an abdominoplasty, we really bend you tight to close everything. So when you go home, you're going to be slightly bent, just a little bit at the knees, a little bit in the back, like this. Walk and sleep like this for a full 3 to 5 days. After 5 days, you'll be able to stand up straight. How do you do that? If you have a recliner, that's fine. If not, maybe a couple of pillows under your knees, a couple of pillows under your back. What I don't want you to do is to bend fully. This will just cause severe back pain. It's just a little bit of pain that gets the tension off. Now, you're going to have a dressing. There may be some oozing. We don't use any tubes or drains. That's because we've closed the pocket up by internal sutures that are called progressive tension sutures. They're absorbable, they go away. But that means no drains. But there may be some blood that comes through the dressings, very small. Usually, we'd like to see you back 2 to 3 days after surgery. We'll do the first dressing change for you. So you really don't have to deal with the dressing at all. The next thing we want to talk about is diet. Now, after surgery, you're going to stay on a liquid diet. Things like soup, juice, crackers, broth, Gatorade, chicken noodle soup, those are all fine. You stay on that until you have the first bowel movement. Now, you have problem with constipation, you should start a stool softener a week before surgery. After surgery, I usually like to wait about 2 days. So for example, your surgery is on a Tuesday, Wednesday, by Thursday night, if you've not had a bowel movement, have laxatives ready to go. Don't wait one more day. You're going to be uncomfortable. And we go through all that when you come back for your second or your third day visit to change that dressing. After our dressing change, you can go home and shower. We see you the following week for any suture removal. The main thing is no activities. You need a lot of help at home. Make sure there is someone there to help you that first week after surgery. If you have any other questions, please contact us. But you get those instructions before surgery. I also review that instructions with the person that takes you home. They're the one going to help you and know what to do because there will be a written instruction for them as well. Talk to you soon.